now.
Okay. All right. So I'll start with a brief introduction of myself. Then I'm going to talk about the art therapy profession. I'll show you a visual transformation video of what it's like for a student to go through the process of becoming an art therapist. And then I'll show you a portion of a clinical case presentation, which will have a case study with an art-based assessment in it. And then we should have some time for, I'll also briefly talk about all of the professions that relate to expressive arts therapies, just to give you a little bit of context of how they work together, and maybe if you're interested in things other than visual art, how you might pursue a career in that. And then hopefully offer you some time for questions. So we'll first start with my introduction. I'm Mary Roberts. I'm an art therapist and I'm faculty here at Eastern Virginia Medical School, finishing my 9th year as program director and my 13th year as in teaching in the program. I taught part-time before. Professionally, I've worked in a variety of clinical settings, often where art therapists work. I've worked in a day treatment school. I've done in-home therapy. I worked for community mental health in Hanover County for a long time on a long-term team working with children and adolescents who had experienced severe abuse, physical abuse, sexual abuse, and combinations, exposure to domestic violence. And I also consulted working with adults. I'm trained in a special treatment called EMDR. And so I consulted on cases for trauma treatment there. While I was at Hanover County, I also volunteered at our domestic violence shelter and ran women's groups. And I've had a private practice. I've worked in a regular school, and I also worked in a detention facility working with children under the influence of violence. And here at EVMS, my focus is trauma-informed care, trauma and neuroscience-informed art therapy and counseling. I've worked with veterans and supervised students working with veterans and military service members, and have written grants to provide art therapy services through the Department of Veterans Services here at EVMS. And I don't know, I'm sure I've worked some other places here and there, but right now at EVMS, my primary role is teaching and running the program. And like I said, I do teach trauma-informed care. I teach assessment. I've taught adolescent skills. I've taught cultural humility. I provide individual and group supervision for students for internships and clinically coordinate their internships. And I teach group psychotherapy. I also co-teach research methods. So there's a lot of pieces and parts to becoming an art therapist. And we have 3 full-time faculty here and some part-time faculty that help students become an art therapist. So I'm going to switch to a PowerPoint now and share with you a little bit more about the art therapy profession. Oh, it's always weird because you can't, hold on. Can't always see. Okay, is it full screen? Okay, cool. Okay, it doesn't on the double. All right, so I introduced myself. So I'm going to talk a little bit about what, wrong person. I'm going to talk a little bit about what is art therapy, and I'll talk about the continuum of care of maybe how people go through different levels of care in the mental health system. We'll have a case presentation by Tiffany, not by Stephanie, and then I'll talk a little bit about other things related to the program. Art therapy is a mental health profession that uses the creative process for healing. And so art therapists are trained to prescribe art materials and different art processes for healing. This helps them to have corrective emotional experiences through art making, and also reflection and processing of that art. So the art process and how the art is made and the engagement in materials is just as valued as the art product. and it's targeted for children, adolescents, and adults. I think a myth is often that art therapists work with children or adolescents, and it's really effective with all ages. And art therapists, like I kind of mentioned, I've worked across the continuum of healthcare. Art therapists also work in a variety of career settings, medical settings like rehab, hospitals, oncology units, dialysis, et cetera. We have a good relationship here with CHKD and Centera, but they also work in psychiatric settings, residential centers, acute centers for risk and suicidal and homicidal ideation, private practice, outpatient services, in-home services, domestic violence shelters, shelters serving individuals in transition and experiencing homelessness, working with aging adults in assisted living facilities, working with adults with substance use disorders, working with adults who may be experiencing dementia or have dual diagnosis of a severe mental illness like schizophrenia and perhaps an intellectual disability. So art therapists also work in schools, incarceration settings, prisons, detention centers. So really a wide range. Art therapists also work in the community and engage in acts of social justice. We currently have a couple of projects going on to work with the community. We have one project called Beneath the Surface, Visual Conversations About Race, which is meant to bring forth the ethnic and racial disparities in Hampton Roads by having a historian present about those, and then folks make response art to that to explore and understand the impacts of oppression and racism. So there's a variety of ways that art therapists can work. We might consider the continuum of mental health care services. So for maybe a child or adolescent, if you follow this path, you could see how services become more restrictive depending on the escalation of behavior or need. So we might see mental health services, school counselors, art therapists working in a public school. And if those services don't quite meet the needs of the youth, maybe they're referred to, say, individual therapy or outpatient therapy. Or if that doesn't work and the school setting's not effective, they might be referred to some type of alternative school. Alternative school really means it could be a school that targets problem behaviors, emotional challenges or disorders, or maybe learning differences. The next level in our systems of schools is a day treatment school where youth actually get some form of scheduled therapy during the day. So they might start with a morning group. How's your day? What's your intention for the day? Any unfinished business from yesterday? Then go through their school day and have maybe individual or group counseling or art therapy throughout the day. Like I said, some might be referred to outpatient or individual group or family therapy. And then we think about what is the kind of trigger or condition in which something becomes more restrictive. So things can be more restrictive if behaviors escalate, or say if there's court involvement, like child protective services. Sometimes children of divorce get court ordered to have therapies, or sometimes safety is a concern and folks need to be placed in a different environment, like transitional housing or shelters, a group home. It's very restrictive to have in-home therapy, someone coming into your home. That's usually some type of court order or community FAP team is determining that your family needs additional services, and in-home is very intensive. They come multiple times a week. There's intensive outpatient therapy, which is often a model used for substance use problems, often individual or group multiple times a week. You'll notice Alcoholics Anonymous programs are available daily, and some folks need to go every day to get that extra support to maintain sobriety. If these types of restrictions and interventions and intensive treatments aren't successful, then someone might be referred to a residential treatment facility. Or if safety is a risk, they might be placed in a detention or jail facility. Another more restrictive environment might be considered inpatient medical, where someone has a medical problem and they can't leave because their health and safety is at risk. Or we might consider acute inpatient, where one has voluntary treatment, but also involuntary treatment to stabilize related to suicidal and homicidal ideation, harm to self or others. And then we also have long-term facilities that are inpatient, for instance, like Eastern State Hospital, adults who are sentenced to be in the hospital environment for reasons related, not guilty, and we call it NGRI, not guilty by reasons of insanity or sometimes prison. And these are all places that art therapists might work. So just a couple of myths about art therapy. Art therapy is not a modality or a tool. It's a standalone profession. It has its own theoretical basis, and it integrates psychological theories from clinical psychology for practice. Art therapists don't conduct art class. They might teach skills in how to draw or how to make something in order for someone to be able to express themselves. But the point is not fine art skill. The point is self-expression. And then some might believe art therapy is fun. And like all therapy work, we delve into personal challenges and problems and lived experiences that are sometimes difficult. And so it's the work of therapy. And although art making can be fun, it can also be very challenging. So what can art therapy accomplish? It gives everyone, it gives clients another language and expression which maybe can't be put into words, and it's symbolic. And it can allow abstract feelings and memories to be expressed. We can externalize the internal, and it offers a lot of choice and self-agency in the process. And our clients can develop a deeper sense of purpose, as well as art therapy and the artwork and the process can be a container for difficult emotions. So some just ideas, and really across the whole spectrum of mental illness and mental wellness, art therapy can benefit, but here's just some common examples of populations and things we might do and serve. Anxiety, depression, pain management, emotional conflicts, loss and grief, challenging behaviors, traumas, crises, coping with developmental and intellectual disabilities, helping build skills for managing symptoms or characteristics related to autism spectrum disorders, developing social skills, working through addictions. So some common goals in art therapy might be to increase self-expression, self-esteem, work through traumatic experiences, develop coping strategies. Art therapy, like other therapies, are looking to promote self-agency and independence, managing stress. In medical art therapy, helping one adapt to any physical limitations. Common things like problem-solving skills. We can also, for those with developmental disabilities, facilitate skill building and hand-eye coordination and gross motor skills. And we're really encouraging nonverbal communication skills and can really promote corrective emotional growth through unique experiences in the art making and reflecting on that. So the differences between art therapy and art making. So you might commonly see art therapy paint night or art therapy coloring books. And these aren't art therapy because art therapy requires an art therapist to be present. And an art therapist is there to guide and actually prescribe which activities are going to help the client for healing. So when we engage in art making or the creative arts and we personally have a benefit from it, we realize creativity is healing, but really what we're experiencing is that for us as an individual, it's therapeutic. For healing to occur and it to be art therapy, there's an art therapist present who has a planned treatment goal, and the client and the art therapist are working towards that goal, and the art therapist has the expertise to prescribe which processes and media will best help get there. Yeah, So I don't need to explain all this. I think that's the best way to explain it. So the art as a product can be a catalyst for insight. However, research shows us that insight alone does not create change. We actually have to help our clients gain that insight or awareness and then practice new behaviors. And that's really part of the therapeutic process and what can happen in sessions. So while art making and going through different experiences could be anxiety producing, the art therapist is there to help mediate that anxiety, help the client practice grounding or other coping skills in session, rather than just forging those experiences alone. So art therapists interpret artwork and analyze artwork through a variety of methods. This is a phenomenological approach to analysis of artworks and not a reductionist or dictionary approach. So we look at it based on all of these things. So, you know, like a dream symbolism journal or dictionary is not something we would use, although it might inform common themes that we might see in artwork, or even Jung's book, Man and His Symbols. We study that book and understand universal archetypes and symbolism, but we don't apply that alone to a client's artwork. The first key is that we need to see the art being made, because the process of how the art is made, how one draws, how one makes art is crucial to understanding the approach and interpretation. We look at the human development, symbolism, form, media, process, associations, behaviors, content, and themes in artwork. For development, there are certain stages of artistic development explored by Lowenfeld and Britton. And so we know, for instance, you might go back and look at your drawings, or if you have siblings or young people in your life, you might notice small children, kind of 3, 4, draw a little cephalopod, a circle with little arms sticking out. That's a developmental milestone. Once they move from scribbling to making that circle with little appendages sticking out, that's a huge, exciting moment for an art therapist, actually, to witness those drawings. But then there's developmental stages in how one draws. Most adults draw at the age of 12 because our creative development is not promoted and continued past, say, 6th grade or middle school art. We also look at symbolism. We look at personal symbols, signs that represent meaning. We look at cultural symbols, universal symbols, archetypes based on Jungian and Freudian theory, and we also look at the combinations of symbols. We try to understand the communications of shapes and forms, sharp shapes, penetrating shapes, smooth forms, soft forms. How are lines and marks made? Is it heavy line pressure? Is it light line pressure? And what might all of these say about the condition or experience of the person? We also consider media. We have a theoretical framework called the Expressive Therapies Continuum by Lucebrink and Hines. And this is a way to understand the neurological aspects of information processing based on art making. And so one might understand the brain in the way that this bottom image is, where we have the bottom of the brain, the cerebellum area is the kinesthetic and sensory area, that's spelled wrong, kinesthetic and sensory aspect of the brain and functioning, perceptual and affective, creating form and feeling, which is your middle limbic system of the brain, cognitive and symbolic, which is your frontal lobe of the brain. And different media will activate different parts of the brain. And this is what the art therapist is trained to do on purpose, not just haphazardly, and also work with the client's preferences. And then you see creativity moves throughout all the levels through the center. And when someone's in a creative state or a state of flow, if Csikszentmihalyi identifies, this state of flow is what fires your corpus callosum, which is your sense of self. It's the membrane that connects your lobes down the center of your brain. So the process is just as important, and the client needs to be allowed to go into the art making process, hopefully reaching that state of flow without interruption. So we're not talking to our clients while they're making art. If they talk to us, we might engage briefly, but we're redirecting them back to that art making process. We're hoping that the clients are sublimating their energies and anxieties and experiences into the artwork so that we can understand those processes. We do art talking after the artwork is created, and the process, again, is equally as important as the product. And the process is more important in art as therapy approaches than the product is. And the process could be the therapeutic intervention. We also consider the associations, what somebody says about their artwork, spontaneous associations prompted, or the questions we might ask about artwork, the client's viewpoint, any metaphors in the art that represent the client's life or things they say out loud, their here and now thoughts and feelings. We consider the behaviors, so observation skills are very important for the art therapist. We are interpreting those behaviors in the context of the session and the client's experiences. We don't want to look at art that we don't witness being made. We don't know the context and condition in which that art was made. And we might use our assessment skills for understanding behaviors and interpreting them. And we're also intervening on behaviors related to our theoretical approach. We're also looking to intervene and treat behaviors that relate to a referral. We want to understand the content and themes in artwork, and here are some common content and themes that we might see in artworks. We might see depression, a lack of color, light line pressure, negative self-statements, low energy, apathy, difficulty forming words. So we can see those same criteria of depression that you would find in the DSM-5 through artwork and behaviors. So here's some examples of common themes. And then we follow some guidelines for interpretation. Art interpretation is a subjective science. It's not evidence-based. We continue to try to create an evidence base, but as we know, creativity is difficult to measure. We do have research, both quantitative and qualitative, to understand and support some interpretations. And we're always looking in the context of the client and what the client says about their art, just as much as what we might see. You're working very carefully as an art therapist not to project your own ideas onto the artwork and to check them out with a client each time. We have an art therapy code of ethics, and we also strive to maintain our art therapist identity and boundaries and how we honor the art and respect guidelines for interpretation. And we also want to use those interpretations to drive the next process or media that we're going to prescribe for clients. So maybe I'll pause here and say, does anyone have any specific questions that are bubbling up right now about art therapy or how we might look at artwork?
And you can feel free to either unmute or type your questions in the chat, whichever works better for you. Looks like you're explaining it very well.
Okay. So what I'm going to do now is hopefully show you a brief video. To practice as an art therapist, you do need a master's degree in art therapy. It includes all of the psychological theories and assessment, psychopathology, group counseling, etc., much like a counseling degree, and includes learning how to prescribe art processes and media and how to understand artwork. for your clients. So it's a combined or integrative profession in that way. And so for visual art therapy, the art therapist is mostly working with visual art media across the continuum: drawing, painting, clay, sculpture. And prerequisites to come into the profession would be coursework, 18 credits of studio art and 12 credits of psychology. Psychology credits are abnormal psychology, theories of personality, and lifespan or development across the whole lifespan, not just one section like child or adolescent, and then a psychology class of your choice. And so this combination of psychology and the arts is what usually leads people into this profession. They believe creativity is healing, and they have a desire to help people and an interest in psychology. The same thing would be true for the other 3 disciplines of expressive arts. Music therapy has a combination of skills and competencies in composing, listening, forming, and history related to music and psychology. Music therapists in the United States some can practice with an undergraduate degree, and then they have a master's level, which is usually 1 year more of study, that offers the clinical training and internships one would need to practice in the clinical realm of music therapy. Then there's also dance movement therapy, and this profession involves awareness of body movement, body form, body space, body expression, dance, and they look at how one holds energies in the body, how one is able to facilitate expression of the body, tightness and tension in the body, and how to release that, integrated with psychological concepts and treatment planning. And then drama therapy is another discipline in expressive arts in which one might use puppetry, role play, acting, and dramatic experiences in order to externalize in a very gestalt way lived experiences or corrective practice of emotional experiences. And so there are degrees in each of these disciplines: art therapy, drama therapy, dance movement therapy, and music therapy. And there are also degrees in expressive arts therapy, where you get exposure, a little bit of exposure to each profession and discipline, and can work as most of those folks are called creative arts therapists or expressive arts therapists. As an art therapist, some additional training that I've sought is certification in play therapy, EMDR, which is a trauma therapy, as well as I attend expressive arts therapy conferences and engage in dance movement therapy. Although I can't say I'm confident in performing that, I just really like it and can see how useful it is. And so I'll do, intentional movement warm-ups with my clients at times. And so you should always work in your scope and have training to do what you think is going to help your clients. So those are kind of the different ways that you can pursue creative arts therapies as a profession. Anyone interested in creative arts therapies as a profession or have questions about it?
Yeah, and while you all are thinking of questions, just a little plug that if you are interested, particularly in art therapy, EVMS actually has one of the best programs in the country, and they're right across town. So it's a really great opportunity. And I know that there's like some music therapy in the state at Shenandoah. I'm not sure about the other 2 types.
Yeah, there's no dance movement therapy in Virginia, and I'm not sure if there's any drama therapy in Virginia. Yeah, there is music therapy at Shenandoah. We also, if you're interested in visual art, art therapy, art psychotherapy, and counseling, our program is accredited, and we will be pursuing K-CREP accreditation for counseling soon. We also offer opportunity for you to come and tour campus or attend a webinar if you're interested. And I've also had undergraduate interns do different tasks in the program from Virginia Wesleyan. So if you're interested in interning with us, you might get to observe some of our community service projects and art therapy in the community. You might get to research some articles, work on social media posts for mental health awareness and art therapy awareness. So there's some different tasks that you could do that can contribute to advocacy for the profession, as well as helping you get to know the profession.
And I'm trying to remember, your program is like 2 years plus 2 summers, is that right?
Yeah, it's just one summer. The program is 5 consecutive semesters. That includes one summer, and it's about 2 years. It's a rigorous program. The first semester is 19 credits, but some of those are practical credits. We have a basic skills class, which is practice. We have processes and materials class, which is a studio-based class where you learn the different effects of different art media and you develop skills in art media in case 50% of our students are psychology majors and they may not have as much confidence with art media. Even if they've taken their studio classes, this helps kind of bridge the gap there, as well as developing the competency to prescribe art materials. We are a face-to-face program. We do have a few classes that are online. So in that way, we might be a little bit hybrid, but overall, we're primarily face-to-face. We have a 2,000 square foot fully stocked studio. So students don't need to buy additional art materials unless there's something high quality and special they just love to use. We also have standardized patients. We're the only counseling and art therapy program in the country with standardized patients. These are simulated cases that students perform assessment and verbal counseling skills with the standardized patients in a session. And then that standardized patient comes out of role and is teacher and helps you identify what was really effective, what were your challenges, gives you direct feedback. And this is, we have you do these standardized patient experiences before we put you with clients who are vulnerable, so that you have a sense of who you are and your skills, and we have a sense of who you are and your skills. We have
That's such a unique program. I actually, my former massage therapist, she's actually stopped doing massage because she loved it so much. I think she still does some standardized patient, but she's actually like a supervisor and helps organize things now.
Oh yeah.
So she told me all about like the med students use it as well. And it just seems like a really cool program.
Yeah, it is really exciting. This prepares our students for internships, and they have 3 internships, one working with children, one working with adolescents, and one with adults. So we really like to see our students have a wide range of experiences and be highly employable. We have a 90 to 95% employment rate within 6 months, and a 92% retention rate. We have a lot of support in the program, and we're dedicated to them finishing and becoming art therapists. It's also grad school, so people really want to be here.
Right. And I also remember you saying that sometimes sites have like created jobs for your students after they graduate, because having them as interns, they see the value of having an art therapist.
Yeah, we have had some sites create jobs, especially pre-pandemic. Pandemic has kind of changed some things a little bit, but a lot of our students are able to, at least, even if they don't get hired somewhere, the value's there and that translates into a system. So that's been exciting.
Yeah, that's actually a good question. How did the pandemic affect your program? Because I know, like you said, there's such a value in being in person for you all, particularly with the art portion.
Well, we taught everyone how to do telehealth, and now that's part of our curriculum. So that was an exciting growth opportunity for faculty and students to convert those skills. We had the privilege, except for stay-at-home orders, we had the privilege to decide what was crucial to be in person. So our processes and materials courses were still in person, and we had 2 sections and more physical space and gloves and masks and all kinds of disinfecting procedures. So we kind of functioned in a hybrid model throughout the pandemic, some online teaching for some classes and some face-to-face. But I would say our greatest impact is some internships disallowed visitors and interns, so it reduced our pool, and we're kind of like getting back up to speed with some of that. But we still had interns in placements. We had some delayed graduations because of it, but I think we've recovered from that mostly. And really the benefit is now we have a lot more lectures that are online, so students can like rewatch things and watch them ahead and come to class, and we make art more in class now because the lectures are posted online. So in some ways it was this really great growth opportunity, and I think students are getting a benefit from that repository of teaching material that's now enduring for them.
Yeah, that makes a lot of similar things here where, I've now learned to use Zoom every class, so if a student's sick, they don't have to really miss, they can Zoom in. And similar with our internships, our undergrad interns had some of the same issues. Well, of course, in 2020, just no one could go do any hours anymore. Right. But, last year, I remember one of my interns had to actually be like hired by the place because they were only letting employees come in. So it made it a little more complex.
Yeah, that's interesting.
All right. Any questions, guys? I know 9 a.m. is really early. It's really fun. This class used to be at 9:30, and just like that difference from 9:30 to 9 makes it a little more challenging for all of us.
I'm sure. I get up early. I already graded papers from 5:30 to 7 this morning. So
yeah, and my 3-year-old wakes me up at like 5:30. So, but I know that that's not the case for undergraduates, nor was it for me as an undergraduate. So I understand. Yeah. Any other questions about art therapy, about working with clients, about grad school, about the art therapies in general beyond just visual art? All right. Well, in that case, I'll just say thank you so much, Dr. Roberts, for coming in. We very much appreciate it.
Nice to meet you all today, and thank you for listening to and getting exposed to art therapy.